சரி, சரி. Good afternoon, everyone. Welcome to the joint GME President Fellow Graduation, the 28th of such event. Today, we celebrate our graduates, not just today, but forever. I'm Dr. Iponye. I serve the GME and DIO at Morehouse. Please, could you have family members, friends, if you could please stand up to be recognized? Thank you so much. They could have done it without you. There's no way. Thank you for your support. There's no way they could have done it without you. As we celebrate today, we celebrate a class of excellence, dedication, compassion, teamwork. This is the class that cared for our community during the COVID pandemic. This is the class that went towards an infectious disease when people were running away from the disease. A class of courage, integrity, honesty. As we celebrate them, I also want to acknowledge our faculty and program director, our leadership. If you're able, you cannot be recognized. Thank you. It takes a village to train a class, and we have a wonderful village. As you graduate today, my message is, this is a journey, not a destination. Graduation is still a journey. It's not a coronation to the seat of wisdom. I implore you to be lifelong learners. It's still okay to say, I don't know, I will find out. Because nobody knows it all. It's still okay to say, I'll call somebody, I'll call a consult. It's still okay to say, give me a minute, I'll look it up. That makes the best doctor. And that's the true seat of wisdom. Humility, the desire for lifelong learning. I trust, I know that this class will be good ambassadors of Morehouse Club Med. Thank you, family members, friends, faculty, graduates. This is your day. I'm going to call on Dr. McCoy to lead us in prayer.
Thank you, Dr. Ivanye. And let me say good afternoon to all. This is a wonderful celebratory activity that we are pursuing this afternoon. So let me again begin my prayerful moment with the scripture from 1 Corinthians, the 13th chapter. It says, love is patient, love is kind. It does not envy, it does not boast. It is not proud, it does not dishonor others. It is not self-seeking, it is not easily angered. It keeps no records of wrong. Love does not delight in evil, but rejoices with the truth. It always protects, always trusts, always hopes, always preserves. Gracious Creator, as we bow this afternoon, give an honor to you and to the learners that have finished this course in their journey. We are thankful for them, for their diligence, for their pursuit of excellence. We are thankful for this moment to celebrate their activity. We're thankful for the supporters, the families, the mothers, the fathers, the sisters, the brothers, the friends. We are also thankful for the leadership of Morehouse School of Medicine, its president and CEO, its dean, the chairpersons of the various departments, and most especially the clerkship and the graduate program directors. We're thankful for the staff that has supported these learners as they have traveled through the halls of various clinical situations and hospital situations. We ask, gracious God, that you would be with them as they make the next step in their journey. Give them the love that is written in Corinthians, that they may love unconditionally, that they may serve with hope, with empathy, and with care. We again, gracious Creator, thank thee for creating us in your image, that we may deliver to your people excellence in care. This is our prayer. Amen.
Thank you, Dr. McCoy. I will now call on Dr. Reba Kelsey, standing for GME and Program Director of Family Medicine, to give us the.
Good afternoon again, everyone. And I would like to reiterate a warm welcome to today's GME joint graduation, which we have done for the last several years, at least 10 years or so, because we recognize that although the residents and fellows are in different spaces as they train, that they come together all at once during their new resident orientation, sometimes may not rotate in the same spaces or see each other, with the exception of on the continuing resident orientation periods, but they are family. We are family. And so we bring our graduates back together upon the completion or near completion. We still have another few weeks. Near completion of training, to pause and to recognize the accomplishments that these amazing physicians and amazing human beings have made. They've made wonderful accomplishments, have been excellent physicians, have been kind to each other, and really have demonstrated what Morehouse School of Medicine stands for. And so for that, we pause in a time when we are often engaged in the busyness of life, that it's important for us to really pause and recognize those things that we have done well and done good. It's important that we pause and thank those who have supported us. And so I'm again going to ask that the family members just kind of raise your hands, and I'm going to ask that the graduates stand and congratulate and thank those who supported you. So if you would just stand and thank your family members. So we are pausing again to give that thanks. And then before you sit, turn to the faculty. And we give our thanks also. And we reflect. We take this moment also to reflect on all of the ways that we've grown, all of what we have learned, all of the ways that we have done exactly what the theme of this graduation says, is rising to face the needs of an ever-changing world. And this class in particular has seen the world change. We saw, some came to residency before we knew anything about COVID-19. And you think about the difference between the way that you trained before and the way that we approached patients before, and then during the early stages of COVID, when we went very rapidly between the approaches to managing COVID, to understanding even what it was, and then later to having a vaccine. And so in the ways, just really, if you reflect on the ways that you've stood to the various occasions that you were called to stand for. And so we reflect upon that and really are grateful to you as trainees that you were willing and you were ready and stood prepared to face those challenges of this ever-changing world. And then finally, we recommit. So if we think about those things that have been instilled in us, the reason that we came to Morehouse School of Medicine, understanding that we exist to meet the needs of those whose needs often are not met. We came because we believed in the vision to lead in the creation and advancement of health equity in the pursuit of justice. And so, yes. And so we recommit to those things. We recommit to those values, those high character values, remembering that we speak with truth, that we look at the person and the circumstance that's in front of us and think about what's possible. And we think about how we create balance and harmony in the world around us. And so we recommit to all of those things and state that we will carry those things forward. The graduates of the 2023 class of 2023 GME, that you will carry those things forward as you care for patients in spaces that might not otherwise be able to access care. And so we thank you, we salute you, we honor you on this occasion. Now I'm delighted to call before us Dr. Keisha Burgess, who is the Resident Association President, for parting words.
Dr. Ivanye, Dr. Kelsey, y'all kind of took some of what I was going to say, so I don't know what we're about to do up here, but we're about to find out. Thank you all so much. Class of 2023, it is such a pleasure to stand here before you. I'm so proud. I'm so proud, y'all. We're about done. But they asked me to come give parting words as your outgoing Resident Fellow Association President. I don't know if Dr. Ivanye wants to rethink that. It's not too late, but we're here now, so we're just going to get this thing going. But on a serious note, when I tried to think of what you all would want to hear, honestly, all I can come up with was thank you. Thank you for answering the call. You have spent 4 years in undergrad. Some have obtained a master's, 4 years in medical school, 3 to 5 years of residency, 2 to 3 years of fellowship, and Lord help the ones that are going into sub-fellowship. None of us could have done this unless we were called. Called to care for the helpless, a calling of which not everyone is qualified. Thank you for your sacrifices, the missed time with family. I'm sure we've missed birthdays, anniversaries, weddings, graduations, and so much more. Thank you for running into COVID rooms when others did not want to treat COVID patients. But can we talk about COVID for a minute? Y'all remember running into COVID rooms and coming out trying to be careful, taking off the mask so we didn't spread the COVID, or wearing our mask so long to where it was so dirty on the inside that we broke out in rashes? I know y'all did, because I did. Or sweating during codes, and unfortunately seeing patients pass over and over and over again, despite what we've done. The apprehension going into this pandemic was crippling. And frankly, the trauma that we've unfortunately been through should have never been our reality. But with all that we've witnessed during this pandemic, I am positive that it's made us into stronger physicians. So thank you for the sacrifice that you've made by putting yourself at risk for years. Thank you for the relentless studying. Yes, we did study, Dr. Ivanye. Studying into our backs ache, losing focus during didactics, and coming back to answering questions after 12-hour shifts, 24-hour shifts, 28-hour shifts. We still made it through. Only our patients benefited because it prepared us to be their instrument of healing. You sacrificed your time, delayed life plans, and altered future plans. Thank you. Some have cried on the shoulders of others, of our colleagues, when rounds or procedures became challenging, possibly experienced depression and anxiety. and then danced and I think I heard an amen, I'm not sure. But we danced and laughed it off as we're doing now. So thank you, but I hope we've all learned to get into therapy because we can't neglect that. Thank you for taking the time to lead and teach. Leading our medical and PA students who relied on our guidance and counsel as we navigated our own way through training. Thank you for inspiring and teaching them. Morehouse would not be able to carry out its mission without us. Thank you for caring for our community, the underserved. Not all physicians are able to reach our community in the unique ways that we do every day. Thank you. And to our family members, spouses, mentors, friends, thank you as well. Because without your support, as we've all have said, we would not have been able to make it. Thank you for your patience, because we know at times it can be challenging when we're stressed. Thank you for your grace when we miss important events. Cooking our foods, managing the small and large things when we weren't able to. And a special thank you to our mentors who have guided and supported us throughout our journey. Finally, and most importantly, thank you to the patients who have entrusted us throughout our years during some of the most difficult times of their lives. As we wrap up this chapter of our lives, I'd like to remind you all of a few things that I hope we would have learned throughout residency and fellowship. Like Dr. Ivanye said, it is okay to err. To err is human. However, it is never okay to remain complacent. Continue to learn. We cannot expect to know everything about our respective professions in a few short years. It's okay not to be okay at times. Growth often requires stress, and in these stressful moments, utilize your proven techniques in order to restore yourself and to restore your health. Never be afraid to ask for help, because there is strength and power in asking for help. Remember to be compassionate and patient with our patients, their families, and your staff. Remember that we can learn so much from listening. And lastly, class, I'd like to implore you, all of you, to continue your journeys, to remember those who follow. Continue to inspire our medical students and our following resident and fellow colleagues. Please don't forget to lift as you climb. Our work is not done, it has yet begun. So as we leave here today, although we have to go back to work, we might want to rethink this plan, but I'll talk to y'all afterwards. Please remember your why. Why did we sacrifice years of our lives to medicine in the service of others and just for the training? Everyone's why is different. So I encourage you to reflect on your why now and often in the future. Our journeys have not been easy, but our whys should have made it worth it. I pray that your careers reflect your whys in every choice you make and benefit the health of our great community. Lastly, for real, I ask that you all reflect on your journey so far. Although it may have been riddled with challenges, some tears, literal sweat, anxiety, depression, imposter syndrome, and probably so much more, please stand grateful. Grateful that through it all, you have remained steadfast, succeeded, and excelled. Stand grateful for every challenge because it has conditioned you to be the physicians you are, a physician that you, your family, and your community can be proud of. And again, I'm proud to stand amongst you all, such a resilient and capable class of physician leaders. My hope is that we continue to be physician leaders who lead with passion, grace, humility, and enthusiasm to improve the health and lives of our community. And I can't wait to be able to call on all y'all, so make sure you save my numbers because I will call. And congratulations to everyone. Thank you so much.
Now we'll have a message to the graduates by Dr. Errol Cook, who is our Senior Associate Dean for Clinical Affairs and the Chief Medical Officer. Please welcome Dr.
Thank you for the introduction, Dr. Kelsey. Thank you for the invitation, Dr. Vanier. I usually walk, but I know this is being live streamed, so I'll stand still. I am really honored to have this opportunity to speak today. Dr. Montgomery Rice and Dr. Tyndall are out, but they send their congratulations, their wholehearted best wishes for you in the future, and their basically statement of confidence in what our graduates are going to do over the course of their careers, and their thanks for what they've already done. So I greet the graduating residents, I greet their family, I say congratulations to you again. I think it's been said well already. I won't have you stand and wave and clap again. I recognize I stand between now and when the real deal starts, and I hopefully will be brief. So you guys have come to another milestone in your life, and these accomplishments really do deserve the same level of congratulations that you've gotten every other time you hit one of these academic milestones. And the fact that you are sitting here means you've hit a lot of academic milestones because your family over there guided you here for your whole life. So you had pre-K, K4, kindergarten, probably got pictures in all the family albums of all those little cap and gown pictures for that. Lower school, middle school, high school graduation, college, first master's, second master's, the MPH, some of you the doctorate, and then medical school. And now here we are at another graduation, but this one is different. And all those other ones, it was about congratulations. This one is really more about thanks. Because in this part of your journey, yes, you have been learning. Your learning curve is actually steeper than it ever was in any of those other parts of your life. But your service was, quite frankly, outweighed the learning by far. If we were to imagine the U.S. health system without our residents in training, it would be a really scary thought. Probably scary. It would collapse. You all take care of the most vulnerable, the sickest, the most complicated patients there are. That's true for here, and that's true for almost all residency programs across the country. But it has a particular importance here at Morehouse School of Medicine, and that importance has been well articulated by the speakers before me. Your patients respected you, you were role models to them, they appreciated you, they loved you, and through us, we're going to articulate their thanks for what you have done and what you will do going forward. And I thank you for that job being incredibly well done, and thank you for what you will be doing as we go forward in the future. So Dr. Vanier, when he first asked me to do this, was to give you a charge. I want you to bear with me for a couple minutes. It won't be much more than that, and I get to the charge. Sometimes I start going astray. Just bear with me. I get you back to where we're going to be, all right? So it may surprise some of you to know, particularly our graduates, that we've been having conversations in this country about healthcare and health for over a century. And then about every 15 to 20 years, we have one of those really big conversations. And the essence of those conversations is really about whether healthcare is a right or privilege, right? And one would think if we've been having these discussions over 100 years, we ought to have the answer by now. And I think we all know that we don't. But each time we have the conversation, and I'm not going to go through details of what happened over every 15 to 20 years, each time the conversation was held, it was a nationwide conversation. We made some incremental progress. There are a couple of times where we made really significant progress. One of those is coming up on its 60th anniversary, and that was Medicare. And another one is a conversation that you all were part of. And that was our conversation around Obama. And just think back, if you think back every 15 to 20 years from that, there was another conversation that had great promise, and most of them did not result in anything big, but there was incremental progress. So around the time that we were having the discussions about Obamacare nationwide, in my previous institution, I was asked to speak a good bit about what the president and his colleagues was proposing and the impact that we hopefully would have. I was doing this in Lower Alabama, right? So some of the audiences might not have been as receptive, but I'm still standing here, so I made it out. And so in doing some of those conversations, I give talks within our institution and in the community. And I was actually giving grand rounds to our Department of Surgery. Now, those of you who don't know, I'm an intern, nephrologist. So yes, surgeons do actually listen to internists sometimes. And I got to the question and answer period, and I got a question. And it's one of those questions, and I've had a few over the years. I always try to write them down and save them and think about them, that I call big questions. They're big, huge questions. The questions are simple, but when you really think about it, the answers are incredibly complex. Just the process of trying to get to the answer should actually help move forward, really come toward solutions to complex problems. The question was, is it necessarily a given that enhancing access to health care will enhance the health of an individual or community? It came from a PGY2 surgery resident in the back of the room. I still remember his face very clearly. Is it necessarily a given that enhancing access to health care will improve health of an individual or a community? You guys are sitting there and going, duh, of course it will. But it's one of those questions at the time, we did not really have the data to prove. We had anecdote. We didn't have data. The data that we had at the time really came from the impact of Medicare. So that when someone turned 65 and they got on Medicare and now they had access to health care, did the disparities between those people who had health care their entire life versus those who didn't have it until that time, did they reduce? Unfortunately, we can say the answer to that was yes. So we had a glimpse to the fact that enhanced access really does matter. That's one of those big questions that has been, fortunately, I think, answered over this last 10 to 12 years that we've had the Affordable Care Act. And that data now comes from looking at health outcomes in states that have Medicaid expansion versus those that don't. One I live in, one I was born in, one next door that I worked in going east. I spent a lot of time in a lot of these states around the Southeast. And what we have learned over these really 10 to 12 years in those states that implemented Medicaid expansion, the disparities in health outcomes between those states and the states that did not expand it remain and are significant. They became greater during COVID. You can do a county by county look at that, and you see that in county by county data, outcomes were better in states that had Medicaid expansion versus. So that big question now is one that was a huge question. It led me to pause. We have an answer. And so, that I told you I'd get to this. The charge to you all is to make sure the answer to that question, is it necessarily a given that having access to health care is going to improve the health of an individual or community? My charge to you is to make sure that that answer is always yes for your patients and your community. It's not just about the ones that you're seeing in the exam room. It's not just about the ones you're seeing in the procedural room or the OR. It's really about the community. And we know that you, as members of our Morehouse community, understand that broader definition of community, and you understand the broader impact you have just by being you. Second charge I have for you all is that you recognize that the most trivial question from your patient may be their very, very big question. Do not ever trivialize those questions. Pause, respect them, and give them that big answer that they're looking for, no matter how simple it may seem. Okay? So, with that, I again applaud you. I compliment you. I do the same for your family and friends. I know that you're going to always have the answer to that question. Be yes, that being in your presence means that their health and their health care will be better. And we know that you will make your family, yourselves, your communities, and Morehouse School of Medicine proud in everything that you do. Congratulations, wonderful work, and we look forward to the great things you're going to do in the future.
Thank you, Dr. Crook, for that most meaningful message and important charge. And thank you for the way that you lead, Dr. Crook. You've been here, hasn't even been a year, yes. It hasn't even been a year, and we've seen the positive change from the work that you're doing. And you do it with kindness, and we appreciate that. That makes a major difference in the way that we work together, so thank you. All right, so we have a video message from Dr. Tyndall, who was not able to join us, but did want to leave some words for the graduates. We are going to try to work this sound, and we hope we don't have to read lips. If it doesn't work, I'll ask your indulgence for just a moment. Yvonne is taking the thumb drive to our AV.
Class of 2023, congratulations. So I'm so sorry I can't be there in person to celebrate with you. But
I'm going to
believe
pause to
me, I am
see if
there
we
in spirit as I think about
fix
this proud
that.
moment for all of you. You all have worked.
Is there a way that the sound in the house can be increased?
Class Class of 2023, congratulations. So I'm so sorry I can't be there in person to celebrate with you, but believe me, I am there in spirit as I think about this proud moment for all of you. You all have worked really hard, I know, and residency is not easy by any means. But be proud because you know that you have come to the end of another chapter and you're now truly about to actually engage in your professional career. One of the things I always do and I always say to every graduate and everyone that comes to Morehouse School of Medicine is I say thank you. I say thank you for joining us. Thank you for entrusting your career with us. Thank you for allowing us to mentor you, to support you. Thank you for trusting in our environment as we help to deliver what's really best for the world. You represent something special. You are a graduate of one of the Morehouse School of Medicine programs in GME. You're going to go out in the world and you're going to make a difference. You are going to allow people to understand and see what you're about, mission. I would ask you to take the ethos of Morehouse School of Medicine with you wherever you go. Understand that compassionate care is important and a signature to who we are and what we do and how we expect to deliver care. Be that ambassador for us so that we continue to be proud of not just what you are accomplishing every single day, but what you will continue to do and how you will continue to impact patients every single day. To say that we're proud is an understatement. We're filled with pride about those accomplishments. So it's not just about thanking you, it's also about thanking your family members and your loved ones who put up with, I'm quite sure, a lot over these last several years as you've navigated your training here at Morehouse School of Medicine. So again, I want to say thank you. I know that you have enjoyed the time spent here. I know that you have become part of the family of Morehouse School of Medicine, and you'll continue to be part of that family. Some of you will stay on with us, but wherever you go, make us proud, make that impact felt, and just know that we will be continually proud of everything that you do. Again, congratulations to all of you, and have a wonderful moment as you enjoy these ceremonies.
We thank Dr. Tyndall in his absence. Now we've reached the moment in our program when we give special recognition to those who have been exemplary in their work as a resident or as a faculty member, a program manager, a program assistant, and some special awards to others who have been friends of GME and champion of GME. And so it is always a delight to introduce this part of the program because those who are being recognized were recognized by their peers. We included comments and nominations from faculty, residents, staff. So these persons who are being recognized today are truly deserving of the recognition that they will receive. And so we start with recognizing our faculty member of the year, Dr. Lynn Gardner. Yes, Dr. Gardner, you haven't read the program. Yes, come on up. So Dr. Gardner is the residency program director for our pediatrics program, and is the interim chair for the Department of Pediatrics. So someone who is able to lead in both capacities with excellence and to maintain compassion for those with whom she works, for those who she teaches, for those who she directs, Just really an amazing human being and well-deserving of this award, a Faculty of the Year award.
Oh my goodness. My team didn't tell me that I won, so I didn't know, and so I can't believe it because I know so many our faculty are amazing, so I'm like flabbergasted and grateful. But thank you all so much. Thank you for the confidence in me and for this amazing honor and accolade. I truly appreciate it. Thank you so much. Thanks.
And the Resident of the Year, Dr. Alexandria Portier. So Dr. Portier is a second-year resident in the Family Medicine Residency Program, and I don't see her, so she may be working. Let's see. But Dr. Portier really is, she's here. Oh, where is she? Oh, here she comes. Yes. So Dr. Portier, who is has really excelled in all areas of that where a trainee could. When we consider clinical care, serving as a role model to other residents, teaching, service. She is an exemplary resident, and again, she's a second-year resident and was acknowledged in this way by faculty, residents, chairs, and administration. So we congratulate you, Dr. Portier, for your work.
Okay, I just want to say thank you. I wasn't expecting this at all. I'm very overwhelmed with gratitude and Thanksgiving, and congrats to all the graduates, because that's what's most important. But thank you.
And the Fellow of the Year, Dr. Como Kaur. Who has also received outstanding remarks, again, from residents, other fellows, faculty, administration, just an excellent fellow, so congratulations. Now I'd like to bring to the stage Mr. Jason Griggs. Mr. Jason Griggs, who is the director of GME.
I'm sorry, I do like Dr. Jason Griggs, so that is nice. So I'm here to present I'm here to pronounce the Program Manager of the Year Award for 2023, and that would be Miss Wendy Wright. And I don't know if Wendy is here with us, but in my short time being here for about 1 year and 4 months, Wendy has been a very forceful event in the GME department. So definitely want to give her a big shout out. Thank you so much for the work that you do, Wendy. Managing 2 fellowship programs is not easy, but she does it like it's a piece of cake. And so we're going to have Dr. Owani to accept the award for Wendy. All right, so they must know how much I like to talk, so they give me another one to do. All right, and so of course we can't recognize our program managers without recognizing our program administrators. And so for the program administrator of the year for 2023 is none other than Mr. Christopher Billow. And as you all know, Christopher is our PA, relatively our new PA over the psychiatry residency program and also the CAP fellowship program. And also, most importantly, he's from Chicago. Chicago, stand up. All right. Congratulations, Christopher. No problem, no problem. Give another round of applause. Everybody. And just FYI, so all the recipients for today, we want you all to come back up to the stage, do a big photo op, and everything else. Yeah, you guys could just line up right here. Great. And so, Dr. Ivanya?
Well deserved. The next award is the GME Champion of the Year. We have no other than Miss Bessie Bates. She's been an advocate for Morehouse School of Medicine in the state capital, raising funds for us. Through her activities this year, we're able to get funding for rural OBGYN rotation. We're able to expand the complement for our psychiatry residency program. We're able to increase funding for the child and adolescent residency program. Ms. Bates has been our tireless advocate over 20 years. We're so honored to have her here. Thank you.
Thank you very much for this recognition today. I want to take this opportunity to congratulate you, residents and fellows, on achieving this great milestone in your journey on medical education. I have worked with some of you over the years, and I feel like I know you, and I'm so proud of all you've accomplished. And I wish you God's blessing on your next part of your career track. I've had the honor of working with Morehouse for almost 3 decades. I've seen it grown from a very small medical program into the outstanding university or institution that it is today, and just keep up the good work, and it's a pleasure working with everyone. Thank you.
The next award is a GME Friend Award. This individual has been a true friend of GME, a friend in need, always. During the lockdown, this individual made sure that sensitive documents were delivered to the GME office. He held our mail, was able to adjust his schedule to meet our demand. He's full of compassion, dedication, and a friend, a true friend of GME. So this award goes to Mr. Willie.
Good afternoon, everybody. When I was first told about this award, I didn't know what to say. I just want to thank the GME people. I would like to thank God most of all for giving me the opportunity and for blessing them to see something in me that they felt that I deserved. And I'm just going to continue to do whatever I'm supposed to do. And so I'm in the mail room, and again, my name is Willis. And if you have any problem with any mail, please. And so now you know who to contact. Thank you so much. I really appreciate this.
The, la- as the award says, GME special recognition. This individual is who I call an app, the app called Felicia. If you have any questions on MedHub, on your work hours, on your evaluation, anything, click the app, you get the answer. Miss Underwood was tireless. She's very innovative. She can multitask. She's very adaptable to different roles. She's well deserving of this award. GME Special Award 2023 goes to Felicia Underwood.
You know it's special recognition when two people say something about you. So I did want to just add that as everyone knows, the GME office went through a great deal of transition during the last academic year. And there was a period of time when Ms. Underwood was the only staff person in the GME office. So she was doing, yes, holding it down. Yes, thank you. And so really serving in the roles, all of the various roles that are now filled, and we're able to work together as a team. But I do want to acknowledge Felicia for that. And she continues to work, give high quality work, and is able, as Dr. Ivanye said, to answer any question that is asked in almost any area of the GME office. And so we appreciate you. We really appreciate you. Yes. All right, so our other awardees won't go home empty-handed. So we have monetary awards of recognition for you as well. So if you would come up to hold your checks. I mean, the real ones are, yes, the real ones are coming, but just, your representative checks. All right, so for program manager, program assistant, faculty of the year, fellow of the year, resident of the year, please come back to the stage to take a picture with your checks.
Don't try to catch this, okay? Okay. Yeah. And point it
All right, congratulations again for all of the awardees. And now, for our graduates, we will try this again with our video. Actually, I'm going to ask if our AV team will play it from the booth, and I think we will be most successful that way.
The reason why I chose Morehouse was because of the supportive nature of the program. The moment that I interviewed here, I knew that I would fit into the program and I would get the support to be the type of physician that I wanted to be. The mission of Morehouse really stood out to me because it aligns with my own missions as a physician.
I think being a resident in Atlanta, especially with Morehouse, gives you an opportunity to be more than just a doctor. I think there's a lot of social aspects that you can help your patient in. So we do a lot more than medicine, which gives you a really fulfilling role as a provider for them.
I think I have a very unique insight into kind of what Morehouse stands for because I've been here as a resident, I've been here as chief resident, and I really enjoy working with our patient population.
We are supportive of each other within our classes. Our class is very close to one another, and we're able to support the younger residents and bring them up and teach them, and it's been a great experience since I've been here.
I've really been loving my time here at Morehouse Cardiology's program here so far. It's definitely a great small program. I love the fact that it's small. We get lots of one-on-one interactions with our attendings. The program is very close-knit. Everyone is super supportive, and I feel like as a first-year fellow, I've been getting a lot of support while I've been here. Lots of teaching from both the attendings and the upper levels as well. So I definitely love being here at Morehouse so far.
And so now we will begin the portion of our program where we present the certificates of completion to our graduates. So we'll start with the Department of Family Medicine, and I'll invite our chair, Dr. Omale, and faculty, Dr. Bashui, and any other family medicine faculty. Rita, let's see, where's Rita and Naya, if you would come to the stage also.
Hello. Ekason. K-Duo. And that's all I know. So again, congratulations to our graduates, all our graduates. And one thing, I'm going to steal Dr. Kelsey's thunder here to say that our graduates, family medicine graduates, have all passed their board exams. Now, they're not board certified yet. I say they're board 30. They don't become FID until June 30th, just so that you know. So again, I want to thank Dr. Kelsey, our program director, as well as Dr. Fashi for doing an awesome work. I want to thank our program manager, Ms. Rita Akiode and Naya. And I want to thank Dr. David, Valerie David, who makes things happen for us, especially if we need money. She knows where to find that money. And Dr. Ivani for continually fighting for family medicine. And we are actually the first program in the school. We were established back in 1981. So we sit on primary care. And primary care is the most important thing that we all need to be familiar with. And as family physicians, we do it all. We're obstetricians, we're surgeons, we're pediatricians, we're psychiatrists. What else, Dr. Kelsey? We're it all, okay? So I say, as family physicians, we're womb-to-tomb providers. Womb-to-tomb. We deliver babies and we take care of grandparents. So on that note, I do want to say we're going to keep some of ours. We'll let them know, tell them who.
So I would just like to reiterate the gratitude for the department, the staff, the faculty, really everyone who has poured into our graduates, and to again say congratulations to you. I'm so proud of this class and could go on, but I do not want to belabor our time together. And so I will introduce our graduates, and we'll start with Dr. Chelsea Cohen, who is going to be staying here in Atlanta. And in the program, it just says ambulatory family medicine, but she will be here with us at Morehouse School of Medicine. Dr. David Daniels, who also will be staying here with us at Morehouse School of Medicine, joining the faculty. Dr. Ramaka Dike. And Dr. Dike will be practicing family medicine in an ambulatory setting. Dr. Chinonso Ezike, who will also be practicing ambulatory family medicine in Georgia. Dr. Chinwendu Courier. Dr. Courier, yes. Dr. Courier will be practicing ambulatory family medicine with Piedmont. And finally, Dr. Ola Jumoke Ladapo. Dr. Ladapo will be practicing ambulatory family medicine.
I did want to say one, I don't know if it's a good note or a bad note, that COVID did to us. We weren't able to see all the fashionistas during their period of residency, which we're seeing now.
So again, congratulations. Thank you, Dr. O'Malley, for your leadership. And I am delighted now to introduce the Department of Internal Medicine. Yes. Yes. So Dr. Christine Sharaf, the program director.
Thank you so much, Dr. Kelsey. Good afternoon, everybody, and congratulations to all of the graduates today. Class of 2023, you did it. On behalf of the Department of Medicine, I'm going to be brief, but sweet, because I recognize we're the bottleneck to the heavy appetizers. We have the most graduates of all of the programs, so without further ado, I'd like to just quickly say congrats again. You did it. Thank you so much for all of your service, for your dedication, for your passion, and for remembering your why when it was really hard to. And I know it was hard. So thank you all so much. We're really excited to celebrate you all today. Again, we had our celebration on Wednesday and it was wonderful. But to the best graduates of GME, biased. All right. The first graduate I'd love to introduce is Dr. Rukayat Ajao, who will be practicing as a hospitalist at the Atlanta VA and staying on faculty. Really quick, I want to thank our team too. Sorry, Ruki, really quick. Our program manager, Tara Henderson, our program coordinators, DJ and Raheem, our APDs, Dr. Day, Dr. Miller, who is on vacation, and Dr. Volsi. Couldn't do it without them, so thank you. All right. And thank you all to the GME team too. Sorry, I'm going to throw them in when I when I have chances. Our next graduate is going to be staying with us here for cardiology fellowship, Dr. Chidi Ama. All right. Next graduate is going to be staying here in Georgia as well at Tift Regional Medical Center. It's Dr. Nicholas Arnold, and he'll be a hospitalist.
Let's say a quick word. You know you weren't getting out of here from hearing about me, right? Anyway, I want to thank the professors and everyone, and I just want to say I'm so proud of my class. Y'all have no idea. And sometimes in life we get to experience something greater than ourselves and know that there's a higher power. And I know that that's true because my mom is still here, who almost passed from COVID. She's sitting right over there. She's the light of my life.
All right. Next graduate is Dr. Rosalind Basil, who will be doing endocrinology fellowship at the University of Virginia. Another quick thanks, Dr. Ivanier, you get a special shout out. Thank you for everything. All right, our next graduate, who I'm really excited to announce, is going to be going to Lexington Medical Center as a hospitalist in Kentucky, Dr. Lakeisha Beasley. She's going to South Carolina, sorry, correction. All righty. Our next graduate is Dr. Hansley Bobo, who will be staying in Georgia doing locums. All right, moving along. Our next graduate, who you just got to hear speak just a bit ago, is going to be staying with us as a Grady Chief Resident. Can't be more proud. Dr. Kisha Burgess. All right. Our next graduate, I'm really excited to see come across the stage. She started with me July 1st of 2020 on a team. So Dr. Liz Callier will be staying here as a hospitalist with the Department of Medicine at Morehouse School of Medicine. All right. Our next resident is Dr. Suvrit Chandra, who's going to be doing Clinical Informatics Fellowship, Changing the World, at Icahn School of Medicine at Mount Sinai, New York. All right. Our next resident is going to be doing the New York NYU Hospital Scholars Program, Dr. Albert Chang. All right. Our next graduate unfortunately couldn't be with us this afternoon, but we're still going to announce him. Dr. Dexter Izagu is going to be a hospitalist. He's going to Lexington in Kentucky. Yeah. We're on. Okay. No, next. Yep. All right. Dr. Uche Ezigwe is our next graduate. He'll be doing hospital medicine, nocturnist, actually. All righty. Our next graduate, I'm excited to announce, will be going to New York at White Plains Hospital and being a hospitalist is Dr. Pranicia Gant. All righty. Our next graduate is Dr. Nicholas George, who will be a hospitalist at Reed Health Center. Okay. All right. Our next graduate is staying with us as the VA Chief Resident, Dr. Kendra Ivey. All right. Our next graduate is Dr. Deborah Jack, who will be a hospitalist at Adventist Healthcare, White Oak Medical Center in Maryland. All right, perfect timing. This timer is awesome. All right, our next graduate is Dr. Gabrielle Johnson. Dr. Johnson will be doing locums in Georgia. Thank you.
I figured I didn't want to let Nick feel left out giving a speech, so I just want to thank the greatest thing I've ever done, my boo, Gianna. Thank you for being my light when things were very dark. Thank my friends and my family who traveled near and far. I thank you for allowing me to empty your pockets and your cabinets. So, thank you. And my mentor also.
All right. Next graduate is Dr. Rashawn Johnson, who will be a hospitalist at Navicent Health here in Georgia. All right, next graduate, Dr. Bill Nkasu, is going to be staying, well, close by, as a hospitalist at East Alabama Medical Center in Alabama. Our next graduate is going to be a hospitalist here in Georgia, Dr. Ijeoma Nanabu. All right. All right. Our next graduate is Dr. Alexis Okafor, who'll be practicing internal medicine. All right. Next graduate is Dr. Ken Okons, who will be a hospitalist here in Georgia and South Georgia Medical Center. All right. Next graduate is Dr. Mark Saad Naguib, who will be practicing internal medicine. Doesn't need an introduction, you already got it. Dr. Alan Sanyi will be practicing as a hospitalist at Walker Baptist Medical Center. All right, next graduate, Dr. Lanry Udu will be practicing as a hospitalist in Oak Bend Medical Center in Texas. And last but not least, Dr. Cubino Waters will be practicing internal medicine. That concludes the internal medicine residents. Thank you so much again, and congrats to all the graduates. I get the opportunity to introduce the next group, which I'm really excited to have this opportunity. We're going to be doing our cardiovascular disease fellowship graduates. This was accredited in 2016. We're really excited for our graduates today in the cardiology fellowship program. I'll turn it over to Dr. Nwani.
Congratulations to our graduates, residency and fellowship. I'm Dr. Nikwa Nwani, Chief of Cardiology. As you've just heard, our program was started in 2016, the first fellowship training program. And we are really delighted to have two graduates today as our fourth graduating class since we began. On behalf of our program director, who could not be here, Dr. Melvin Eccles, and our Associate Program Director, Dr. Mohamed Akubesi. They've done a fantastic job nurturing graduates, and also I want to also thank our faculty members who have done an exceedingly good job. Many times, really put through the stress of coordinating teaching and practice. We also want to thank the Department of Internal Medicine, our chair, Dr. Richard Snyder, as well as the GME for supporting our program through some challenging times, especially in the last few months. Without any further ado, I want to invite our assistant program manager, Tariq, up here. I was able to accept the award for the Program Manager of the Year on behalf of Wendy Wright, who has done a fantastic job helping to manage the affairs of our trainees as they went through the challenges of training in cardiovascular medicine. So without any further ado, I want to invite our first graduate, Dr. Eric Chang. Dr. Chang will be going for interventional fellowship in Temple in Pennsylvania. Our next graduate from our program is Dr. Kiona Grant. Dr. Grant will be going into private practice.
Good afternoon. We always follow the program with the most number of residents. And my understanding is that the departments go by alphabetical order. So starting next year, officially we will be not obstetrics and gynecology, but gynecology and obstetrics. And I want to explain to everyone why our program is so small. Because someone before had said they had the best residents or the best program. We have the hardest working residents in the world. In fact, our program is that small because it takes one of our residents to work as hard as 10 of the other folks. But all kidding aside, I want to thank the institution, GME, our residency staff, our faculty, and really all the residents who are graduating. I just spoke with a family member of mine, and they were reminding me that this was a training program for the residents. But I want the family to know that the residents perform the service, as Dr. Crook said, that took care of our patients, especially during this COVID period. And without our residents, our community would not have survived this COVID situation. So our residents are a very important part of the care that we provide to our community. So I want to thank all our residents for that. So, Dr. Phillips, I was going to be short-winded. So I'd like to bring up now Dr. Phillips and Dr. Oluwenwaju Kelly is where to present our residents.
Good afternoon, everyone. I have the distinct pleasure of presenting the OBGYN residents. First, I'd like to say thank you to our program administration, Drs. Olarawaju, who's our Associate Program Director, Kelly Hooper, who's our Program Manager, and Ms. Elisa Ware, who's our Program Assistant, for all of their hard work, both now, this morning before we got here, and again this afternoon, this evening when we do our individual celebration. So first resident, Dr. Kira Cottrell. Dr. Cottrell will be pursuing her fellowship in reproductive endocrinology and infertility at the Mayo Clinic. Our next resident is Dr. Anquilla Delaveau. Dr. Delaveau will be staying here with us in the state of Georgia in a private practice at Eagles Landing OBGYN. Our next resident is Dr. Aaron Doctor. Dr. Doctor will be staying in the state of Georgia and practicing at Southside Medical Center. And finally, we have Dr. Peyton Garrett. Dr. Garrett will be staying in the state of Georgia, practicing in a private practice, Abundant Life Healthcare. Thank you.
Please hurry up. Our residents have to get back to work. And now I'd like our pediatric residency program to come up for their presentations.
All right. Good afternoon, everyone. It is a distinct pleasure to be able to truly stand before you today and to give you all a little bit of information about our pediatrics residency training program. It's a wonderful program. Our graduates more than deserve this honor today. They have been phenomenal, as other speakers have alluded to today. It's during a very difficult time, their entire training practically, and to watch them innovate and problem solve and cooperate and collaborate and just really be a pillar in the way that the program was able to serve our littlest and most vulnerable, one of our most vulnerable groups of patients was outstanding and something to be noted and to be proud of. I would like to thank, as the chair, I'd like to thank our faculty, staff, our other residents, our program administrative team. As program director, I want to thank Dr. Siobhan Brooks, our associate program director, Dr. Roger Burko, our assistant program director, Dr. Anita Moten, who's in the audience, who would come up here if she could, our chief resident, who will be continuing with us as she joins our faculty group this upcoming year, our program manager, Ms. Vanetta Green, and our program assistant, Ms. Audrey Thomas. And so this is a really fantastic group. So I am just, the world looks great. Our future looks bright. We have incredible group that will go out and do amazing things to take care of the children of our nation, of the world, and it's a distinct pleasure and honor to be able to present them to you today. Our first graduate is Dr. Eduardo Castillo-Leon. Dr. Castillo-Leon will be pursuing a gastroenterology fellowship at Nationwide Children's Hospital in Columbus, Ohio. Our next graduate is Dr. Brianna Ferris. Dr. Ferris will be practicing primary care at Wellstar General Pediatrics Outpatient and Nursery in the state of Georgia. Our next graduate is Dr. Dominique Grasty-Hines. Dr. Grasty-Hines will be practicing primary care with Wellstar Pediatric and Adolescent Medicine Center of Georgia here in Atlanta. Next, we have Dr. Jasmine Lawrence. Dr. Lawrence will be pursuing a career as a pediatric hospitalist at Advent Health Center in Orlando, Florida. Our next graduate is Dr. Bhavna Nagareddy. Dr. Nagareddy will be a primary care pediatrician at Tri-County Pediatrics right here in Atlanta. Okay, and finally, but absolutely not least, we have Dr. Miranda Norte. And Dr. Norte will be practicing pediatric urgent care with Children's Healthcare of Atlanta right here in the city. All right, and so I'm going to open the mic to Dr. Deidre Evans-Cosby to introduce the graduates in the Department of Psychiatry. And I might add, pediatrics has the smartest residents in the GME.
Good afternoon, everybody. So I guess we're a little bit over halfway there, and it's, a great time for us to introduce our psychiatry graduates. Everybody's had some very nice things to say, and we reiterate and our congratulations to all of the graduates. It is very rewarding as a program director to remember you all 3, 4, 5 years ago, at that white coat ceremony, taking those oaths, and now to see you just like days away from being independent, and all out on your own, especially since I've known some of you as from medical school. It's just really, really rewarding, and congratulations to all of you. While I'm up here, I just want to, everybody's had some really nice things to say about their graduates, which is all true, but psych is here to really fix y'all now, okay, and to help you all out. Let's get all of this straight right now. I am especially pleased to present to you our graduates. Very proud of all of their accomplishments over the last 4 years. I sincerely thank Dr. Simmons and Dr. Johnson for giving us the opportunity to participate in your training. You guys have done absolutely fabulous. And I am sure that members of our Program Evaluation Committee and our Clinical Competency Committee will agree that these two embody all of the qualities of Morehouse School of Medicine and everything we've tried to instill in all of our trainees. So without further ado, I present to you Dr. Erica Johnson. Since we only have two, I'm going to take a minute to tell you a little bit about how they will showcase our mission. Dr. Johnson served as our clinical chief resident this year. She is also a REACH scholar, which is a program for recognizing and eliminating disparities in addiction through culturally informed care. She is also a National Health Corps scholar, and as such, she will practice in an underserved area within the state of Georgia. Dr. Erica Johnson. Dr. Tiara Simmons. Tiara served as our educational chief resident this year. She is an ambassador for HBCU Cares, which is a Center for Excellence in Behavioral Health for the AUC. She's also an American Psychiatric Association Diversity Leadership Fellow. Dr. Simmons will also remain within the state to practice general psychiatry. I would like to thank my absolute right and left hand, Ms. Kenyana Landon and Mr. Christopher Goodlow, our program manager and program assistant. This has been a very busy year. They were new to their positions and we got through it. They've done a wonderful job and I am sincerely grateful for all of their help. Next up, we invite our current interim chair, soon to be full-time chair, Dr. Sarah Benson and Dr. Nina, to present our Child and Adolescent Fellowship, Psychiatry Fellowship.
Good afternoon. So glad to join you all this afternoon in celebration of our graduates. Have to thank, as Dr. Cosby did, Ms. Landing and Mr. Goodlow because they have been a tremendous addition to our team this year. We could not have done it without them. So thank you both. With wearing both hats this year, it was even more of a team effort than it normally is. And so I just can't start with anything but that. I also want to thank Dr. Mina, who's been the Associate Program Director starting this year, and of course, our fellows. So when they decided to be part of our fellowship at Morehouse School of Medicine, we were only in our second year. So they rolled the dice in coming to train with us. And we are so grateful and so glad that they chose us and took that chance. And I hope that they're as grateful as we are. They are both APA Fellows, which is a national program that is very competitive, and they were both chosen for, and both of them are staying in the state of Georgia. So first, I will bring up Dr. Karen Corsa. And Dr. Corsa will be at Children's Healthcare of Atlanta. And just a little history lesson, Hugh Spalding had never had a child psychiatrist there until our fellows were there. And she is going to be there as an attending now. And last but certainly not least, because we only got two, y'all, is Dr. Darren Lewis, who had such a fantastic job as a fellow, he decided to do another fellowship. So he will be going into addiction fellowship at Emory University next year. And next, we have public health and preventative medicine.
Well, good afternoon to all of you, and thank you all for coming. Congratulations to the graduates. I am standing in for Dr. Tabia Henry Akintobi, who is the chair of our Department of Community Health and Preventive Medicine, and just a few words about that particular department, one of the largest and most diverse. So, you know, when Dr. Crook talked about answering the big questions, that's kind of what we do. So whether you're covering all of the issues regarding maternal and child health, cancer prevention, HIV, chronic disease, violence, all of those things are covered through our department. So it allows us the opportunity to look at all of the big pictures and policy issues and implementation issues. And those of you who were watching as COVID-19 developed, one of the things that was pointed out was that there was definitely a deficiency when we talked about public health and preventive medicine in terms of those folks that had the knowledge about how to prevent it, what to do about it, how to implement programs, how to do the surveillance. All of those kind of things were really part of what we do. So again, congratulations to all of the graduates. I also want to thank all of our faculty and staff in our department, in particular, those that work in public health and in the preventive medicine residency. We have a few out in the audience, and they didn't want to come up, so maybe they can just raise their hands. But thank you all for coming, and I will also introduce our residency director, Dr. Sonia Hutchin.
Well, thank you very much, Dr. Crosby. It's indeed an honor and a privilege to be here to tell you a little bit about what public health and preventive medicine is. In terms of the residency training, it would be a missed opportunity if I didn't take the opportunity to tell you. We would like this audience to leave with understanding what public health and preventive medicine residency is. Okay, so let me just say that when you graduate from medical school, you can't go into this residency immediately. You have to do at least a clinical year. So when they come into public health preventive medicine residency training, 80% is new knowledge in terms of population health. Big questions, as Dr. Crook and Dr. Crosby has said. So we look at ourselves as being holistic. It's one thing to do your clinical work, which they do draw on when thinking through the science and the practice of public health and preventive medicine. But they also need to understand the skills that you need to provide the underpinning of the science that we use to make sure that our interventions are effective. If you don't know, then how are you really going to prevent and improve health and optimize health for everyone? And that's what we do. We have a program in which we have courses through the Master of Public Health program in epidemiology and biostatistics to make sure that we know what's going on throughout the world and in our communities, in our back doors. If we don't know and document this, then anything can happen. So with the Affordable Care Act, that you heard about, all of that is based on evidence that if we fully implement that law of the land, then we should see optimal health for everyone. And it shouldn't depend on your race or ethnicity or where you live, which is the situation right now. So I just wanted to say that. I wanted to let you know that we also work on environmental health. All of the toxins that we're exposed to in the air and the water, that's what our doctors do. They understand what those toxins are and what we need to do to move forward to improve health of our communities and our populations based on these toxins that we are exposed to every single day. So we think about everything else in medicine that's not currently thought about in the clinical practice, which is critical. Our clinical work is critical because we are saving lives of people who already have disease. But we would like to prevent those illnesses from occurring. And we do that through lifestyle medicine and health promotion as well. Now, unfortunately today, our resident, Dr. Samuel Sesu, is unable to be here today. But I would like to say that he has done a tremendous amount of great work with the monkeypox outbreak that occurred in Georgia. And he stayed on to, because he's a physician, to answer all the medical questions about isolating people who have monkeypox, about vaccinating people who have been exposed or might be exposed or might be at high risk for monkeypox. Okay, so what we do is help contain and control the spread of infectious diseases and also understand the patterns that occur in the population. If we don't understand the patterns that occur in the population, then how, again, can we prevent and control these diseases? Because they are preventable and controllable. Smallpox is a great example of how public health and preventive medicine has gotten rid of and eliminated and eradicated a disease. So this is possible, but we do need more public health preventive medicine residents, and Dr. Sesu has done some of that work in health policy, environmental health, and also health policy, and indicating the importance of the Affordable Care Act in improving the survival of people who live in states where there is Medicaid expansion and minimizing the death rates. So I just wanted to say that. I get really excited about that. I've spent 30 years at the Centers for Disease Control and Prevention. I'm a retired United States Public Health Service officer, and I want to make sure that our next generation has the skills and the tools to be able to work in this area. So we're looking for our future. I know there's a number of you are out in the audience who are interested in getting a Master of Public Health and applying those skills through some practical, and developing some skills through some practical rotations that we offer. Our residency is only 2 years, and we do pay for the Master of Public Health. So think about us in the future. We're here, send people our way, because we do need more. We need everybody, all hands on deck, to improve and optimize the health for everyone. Thank you very much.
And I think because we only had one graduate, you got a chance to hear the public service announcement for public health and preventive medicine. So you got a chance to hear the whole spiel. Let me introduce the surgery residency that's coming next and allow them to introduce their grad.
Good afternoon. It is really a pleasure to be here to celebrate 5 years of hard work for our general surgery residents. We really want to thank the GME, Dr. Ivanier, Dr. Kelsey, Ms. Samuels, the leadership of Morehouse, our faculty, residents, and staff, some that you see behind me, our Director of Surgical Education, Dr. Matrika Dansby, our Associate Program Director, Dr. Miller Hammond, Jean Wilburn, who is assisting us in the Department of Education, Kim Hodge, who is our program manager for simulation, and Ms. Domisha Green, who has been promoted to our program manager. Now, year after year, we have this old fight with Dr. Matthews about the hardest working residents, and I'm really trying to put this to bed. But this year, Dr. Sharaf and Dr. Gardner joined in and threw the gauntlet down. So I must let you know that the general surgery residents are the residents most likely to change the world through their passion, advocacy, and leadership. One other thing is that next year, we'll be right behind you, Dr. Kelsey, as general surgery residency. We will be second to present our residents instead of last. I'm very proud to present Dr. Daniel Chester, Dr. Chester. Dr. Chester is a native of Louisiana who joined us after finishing Columbia University and Louisiana State University School of Medicine. He has a passion for health equity and the elimination of health disparities. He will be joining a private practice to perform general surgery in Tennessee. Congratulations, Dr. Chester. Our next two residents are working. No, they could not be with us at this moment. But Dr. Ismail Jallo has been advocating for global surgery. He will be joining Loma Linda University for a global surgery fellowship where he will travel to Malawi and Ghana. Dr. Jamie Herder is passionate about rural health, and she will be joining a practice in North Carolina where she will be performing rural surgery. Thank you very much for your support of the department and the program.
As we wrap up the great occasion, I want to take this opportunity to acknowledge and thank the organization committee led by Dr. Riva Kelsey, Ms. Yvonne Gilbert, Ms. Yvonne Jones, Ms. Temi Samuel, Ms. Felicia Underwood, Mr. Jason Griggs, all the program managers and program assistants. Thank you for putting this together. To our graduates, once again, I say congratulations. Go conquer the world, change the world. To family, friends, guests, thank you for your patience. Thank you for your active participation. At the end of the ceremony, please graduates pick your gift outside. And for everybody, we have entertainment outside. Please spend some time to meet with other family members, meet our graduates, and enjoy the occasion. And thank you all. I want to thank Dr. Crook for your speech, for representing our Morehouse School of Medicine leadership. To the program directors, program managers, program assistants, chairs, thank you. Thank you for all you do, for all the residents, students, fellows. Thank you for all you do. Thank you, and see you next year.
I